So our topic for today's discussion is the pectoral region. So what is the pectoral region? It is this area that lies below the clavicle, in front of the shoulder, that it is lateral to the sternum, that is lying centrally, and it is medial to the arm. So this specific area is called the pectoral region. It includes the anterior axio-appendicular muscles or the pectoral muscles, and these are the pectoralis major muscle, the pectoralis minor muscle, the subclavius muscle, and the serratus anterior muscle. This picture A depicts the muscle that is pectoralis major. When we remove this muscle, the pectoralis minor is seen. This is subclavius that lies in the subclavian groove of the inferior surface of clavicle. And here is the serratus anterior muscle that is attached on the costal surface of the scapula. So the pectoral region is the area, as I've told you before, in front of the chest. It consists of structures which connect the upper limb to the anterolateral chest wall. The breast, which is an important structure, also lies in this region. The various layers of pectoral region are this from outside to inside the skin, the superficial fascia, deep fascia or pectoral fascia, the pectoralis major muscle, then the clavipectoral fascia, pectoralis minor muscle, and the subclavius and serratus anterior, all the muscles of the pectoral region. In this picture, we can see this area is the pectoral region. These yellow structures are the cutaneous nerves supplying this area. These are also the cutaneous nerves of pectoral region. These are the muscles of the pectoral region. This outermost layer is the skin. Now, what is fascia? As I've mentioned in the previous picture, superficial fascia, deep fascia. It is a thin casing of connective tissue that surrounds or holds various structures, including the bones, vessels, nerve fibers, muscles, etc. The superficial fascia of the pectoral region includes the cutaneous nerves, cutaneous vessels, platysma, which is also a cutaneous muscle, breast, and fat. These are the supraclavicular nerves which are giving cutaneous supply to the pectoral region, and these are the anterior and lateral cutaneous nerves, which are branches of the intercostal nerves, which are also supplying this pectoral region. Cutaneous innervation of the pectoral region, as I've mentioned earlier, is through the supraclavicular nerves. It supplies the skin of the upper half, the deltoid, until the second rib. And the anterior and lateral cutaneous branches of the second to sixth intercostal nerves, they supply the area below the level of the second rib. So above the second rib, the supply is by the supraclavicular nerves. Here you can see this is the area of the clavicle and this is the area of the second rib. So above the second rib, we have supraclavicular nerve giving cutaneous supply to the pectoral region, and below the second rib is the branches of intercostal nerves which are supplying cutaneous innervation. Now, platysma is a subcutaneous muscle of the pectoral region. An important thing about it is that it is supplied by the facial nerve. Here you can see this orange structure is all platysma. The various structures of face are supplied by the facial nerve, including the platysma, which is covering the area of the neck. The muscles of the pectoral region are, as I mentioned earlier, the pectoralis major, pectoralis minor, subclavius, and the serratus anterior. In this picture, we can briefly see the attachments, the origin insertion, the nerve supply, and actions of these four muscles. Now we'll discuss them one by one. Pectoralis major muscle, as we can see, this is the pectoralis major muscle, and it is attached to the anterior surface of the medial two-thirds of the clavicle, and laterally it is attached to the bicipital groove of the humerus. We will discuss humerus in detail later on. So one attachment of pectoralis major is to the clavicle here, and the other attachment is, as you can see, on the humerus here. This entire muscle is the pectoralis major. It has three heads. One is the clavicular head, one is the sternal head, and one is the costal head. And all these heads join and are attached on the bicipital groove on the humerus. Now, Poland syndrome is the one in which pectoralis major muscle is absent. As you can see in this picture, this is the picture of a normal individual and this is an individual with Poland syndrome. Here, the pectoralis major muscle of the right side is absent. Now, if we remove the pectoralis major muscle, the muscle that lies below the pectoralis major is the pectoralis minor muscle. It is attached on one side to the coracoid process and to the other side to the third, fourth, and fifth ribs. Next muscle is the subclavius muscle. This muscle is attached to on the inferior surface of the clavicle here and to the first costal cartilage. It is a small muscle and it provides protection to the subclavian vessels and the superior trunk of brachial plexus, as all these pass from the area of the attachment of subclavius on the clavicle. The last muscle of the pectoral region is the serratus anterior muscle. This muscle is attached on the upper 9 ribs and to the medial border of the costal surface of the scapula. It is also called the boxer's muscle. Winging of scapula is a condition in which the long thoracic nerve that is supplying the serratus anterior muscle is paralyzed. So what happens is, if the long thoracic nerve is damaged, the serratus anterior muscle is paralyzed, and if a person pushes against the wall, the medial border of the scapula becomes prominent. This is a condition that is called the winging of the scapula. In this picture, we can see the attachments of all the 4 muscles of the pectoral region. This red structure is the attachment of the pectoralis major muscle. This is on the clavicle, starting on the clavicle, then the sternum, and then the costal cartilage, and it is inserted into the bicipital groove of the humerus. Next one was the pectoralis minor muscle. These thin slips on third, fourth, and fifth ribs. This is the pectoralis minor muscle, and above it is attached to the coracoid process of scapula. Third one is the subclavius muscle. This here is the bluish one is the subclavius muscle. It is on one side attached to the inferior surface of the clavicle, that is the subclavian groove, and medially it is attached on the first costal cartilage. And the last muscle is the serratus anterior muscle, which is attached to the second to ninth ribs, and on the other side to the medial border of the costal surface of the scapula. Now we will briefly discuss the clavipectoral fascia. So it is a fibrous sheath that is situated deep to the pectoralis major muscle, and it is extending from the clavicle above to the axillary fascia below. So extent of clavipectoral fascia is from the clavicle above to the axillary fascia below, and it is lying beneath the pectoralis major muscle and above the pectoralis minor and the subclavius muscle. The upper part of the clavipectoral fascia here encloses the subclavius muscle, and lower part encloses the pectoralis minor muscle. And medially it is attached to the external intercostal muscle, and laterally it blends with the axillary fascia. Here we can see that the clavipectoral fascia above encloses subclavius, below it encloses the pectoralis minor muscle, and inferiorly it blends with the axillary fascia. The important thing about the clavipectoral fascia is that these following 4 structures pierce it. These are the lateral pectoral nerve, the cephalic vein, the thoracoacromial artery, and the lymphatics. So this is all about today's topic. Thank you.